And welcome everybody to our meeting this week. I put in the e-blast, Pam put in the e-blast. We're flipping our program today because our guest speaker, Katrina, has another obligation at 11:28. So just know that we'll do the Pledge of Allegiance, invocation, and then we're gonna hop right into our program today. So appreciate everybody's flexibility. So with that, we'll do the Pledge of Allegiance.
Okay, we'll pull that up. Step out of the way.
Oh, somebody's got a call. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Jessica, for that. Okay. So we have Anne Surrett today to give us our inspirational words and our invocation. Anne?
Thank you, President Susan. Thinking about the vaccine that's rolling out now and the fact that we are apparently coming, at least we pray, to the end of this nightmare, I found a poem this week by a young British poet called Ursa Daly Ward. And I thought it was appropriate as something to maybe think about as we move into this new phase. Sometimes you think it's all over, when in fact, you're standing at the edge of a new age. Old practices, paradigms, and patterns fall away because they must. They leave when it is time, and it is time. You are ready for newer things, larger and bolder than what you left behind. The idea of loss is mostly perceived anyway. Every single day, you gain more than you lose. You attract newness as naturally as you breathe. Thank you.
Thank you, Anne. Has almost double meaning today. So with that, we'll go to program, and Cindy Linesar, you want to kick our program off today?
Be glad to. President Sue already said this, but thank you, President Sue, and everybody for being here on time today. Today is an extremely exciting day in the step of COVID, which our speaker, I'm sure, will let you know about. But before we get to that, I'm going to tell you about our head table, which may or may not be here because of this very day. So first, we have Dr. Farah Etzel, who is a pediatric hospitalist at Salem Health, as you all know. And if you follow her on Facebook, she's had her first dose of the COVID vaccine. Second is Kristen Coons-Barber, who may or may not be here because of our exciting day. She is the Strategic Partners Manager at Northwest Human Services and also serves with me on the Marion County Health Advisory Board. And we have a very exciting day today, which you'll hear about. And I was going to have a red badger, but I couldn't attach to anybody. So just say there's a red badger here and we'll give them credit for it. So with that, as I've alluded to, today is a very exciting day. COVID has been the top story for many, many months, and it is my pleasure to introduce my colleague and friend, Katrina Rothenberger, who since 2018 has been the Public Health Division Director at Marion County Health and Human Services. She received her Bachelor of Science at Community Health Education from Western Oregon University and her Master's in Public Health from Oregon State University with an emphasis in health management policy. Katrina started her public health career at Polk County, where she worked for nearly 5 years as the Public Health Emergency Preparedness Coordinator, Vital Records Deputy Registrar, and Public Health Administrator. So I gotta say, if you want someone who knows how to organize, get people moving in the direction, and saving lives, you want Katrina on your committee. She's an amazing person and has been leading our COVID response as a county health administrator since this started. And when she's not doing this, which seems like a 7-time full-time job since last March, for fun, she likes to take her daughter, Eleanor, to the Oregon coast and play in the sand and fly kites and watch the waves roll in. And so with that, I am honored to turn it over, because it'll be an exciting program with lots of questions, I'm sure, to Katrina.
Thank you, Cindy. That was such a nice introduction. Can you hear me okay? Great. I'm going to share my screen. I do have a brief presentation. It is taking a minute to get into presentation view. I just got this new computer, so, oh dear. There we go. I did this earlier. There we go. Okay, thank you for having me. You all sound like such a fun group. I think I'll come back next time if you'll have me. Like Cindy said, I'm the Public Health Division Director here at Marion County. It's a real privilege and honor for me to be here. I think so highly of my colleagues, my community partners, the staff here. They've just been working so hard, and I feel like my job is easy when they are all around and supporting one another. It's been a really strange but good experience throughout this pandemic, for whatever that's worth. And that's really because of all the people who've really pulled together to make our community a healthy and safe place to be. So with that, I'll get started. And I do have oh goodness, here we go. My public information officers created this PowerPoint for me and decided to put a picture of me in here. That's not something I would normally do, but I was really excited about the Moderna vaccine arriving last week, and we all wanted to see it and take pictures with it. It has to be stored at -20 degrees in our freezer. So I actually had a nightmare last night that I had left vaccine out, and just woke up just furiously thinking, oh my gosh, I could not have left the vaccine out. Luckily, they don't really let me touch it, and I don't know the code to get into the room, so that's good. Anyway, on a serious note, the county health department does receive the Moderna vaccine. We will be receiving weekly allocations. This week, we learned that we will be receiving 500 doses. The Moderna and Pfizer vaccine have both shown to be effective. Pfizer vaccine is around 95% and Moderna around 94% effective. We distributed our first 700 doses to local emergent EMS and first responders. So we gave 200 doses to the Marion County Fire Defense Board, and they've really been the ones coordinating with the fire personnel in Marion County. We gave an additional 500 doses to Salem Fire for police, fire, and dispatch, and they began administering doses yesterday. And I had the privilege of receiving my first dose alongside Chief Niblock yesterday morning. So it's been great to see such a warm reception to the vaccine in our community, and hoping to get those vaccines out as quickly as we possibly can, while continuing to educate folks on the safety and effectiveness. We did hold 100 doses back for us at the health department in order to immunize smaller groups. So we'll be immunizing some folks from the FBI who are stationed in Salem, from the Ombudsman office, from other smaller urgent care centers. So and then we'll be making a plan to immunize our staff in the coming weeks. All right, so vaccine in Oregon first arrived on Sunday, December 20th. And then as of January 5th, I just checked right before this presentation, we've administered 54,579 doses in Oregon, including 4,694 in Marion County. The Oregon Health Authority has a really nice vaccine dashboard, and the counties are in various shades of blue, and the darker blue the color, the more vaccine is out in your community. So my goal is to keep Marion County dark blue in terms of getting those vaccines out. That means that we've immunized more people. So as you look online, I can share the website with Cindy later. Seeing us in a darker shade of blue means that we are doing great getting the vaccine out. And Salem Health, one of our partners that we've been working closely with, it will be doing some open pods for groups, phase 1A, groups 1 through 4, those frontline healthcare personnel who are working in the congregate settings, other healthcare personnel, public health, early learning, death care workers. So we're really excited that more vaccine will be getting out into the communities quickly. I'm super impressed with the operation that they have set up over there at the fairgrounds. There is a phased distribution which prioritizes the healthcare workers, first responders, long-term care, residents, and staff, which I mentioned. The long-term care facility are signed up with the federal pharmacy program for the most part. And to be quite honest, we haven't had great awareness of how that vaccine is rolling out in those long-term care facilities, which is pretty concerning for us from the health department perspective, because it's an area that has the potential for severe illness and death. So we've been asking Oregon Health Authority for information. That has to come from the corporate pharmacies. What we've been doing to make sure that our facilities are signed up with this pharmacy program is basically calling and asking those that don't show up on our list that we've received from the state and saying, hey, what's your plan for getting vaccine? If there are any facilities that are not signed up, Marion County Health and Human Services, we will find a way to get them vaccine quickly. We do know that some facilities, some long-term care facilities have been receiving vaccine already. It feels like it doesn't feel good enough that we don't have a great awareness on that yet. So anyway, there's a lot of good news and there's a lot of like, oh my gosh, we really need more information for us to feel comfortable moving forward with additional doses of vaccine to the public, or to the additional phases in the sequencing plan. All right, so Marion County Health and Human Services has been planning for vaccine allocation for several months now, not really understanding from our state partners what that would look like in terms of how vaccine allocation decisions would be made, how distribution would go. We made a lot of assumptions early on, and I think that put us in a good position for when Oregon Health Authority decided, okay, we're gonna enroll hospitals, first responder agencies, local public health authorities into this state system called Alert. And if you're a provider that's signed up with the Alert system, that means you're able to administer the COVID-19 vaccination. So the goal of our plan is to provide a framework for coordination across the county and state partners. The goal of reducing and eliminating the disproportionate impacts of COVID-19 and preventing community transmission. Our framework is based off of the CDC's Playbook for jurisdictions and the Oregon Health Authority's Vaccination and Sequencing Plan. It provides an overview of our planning process, all of the partners that we engaged to ask them, you know, what are your concerns? What's the best way to get this vaccine out into our community and to communicate and build trust? We found transparency is super important, working with our community-based organizations and just providing as much information as we possibly can as we receive it, being transparent with the process, how decisions are being made, and where those decisions are being made was very important to our community partners and to the people who are administering vaccine. Our public information officer team also developed a communication plan to ensure timely, accurate, and accessible information about COVID-19, developing social media posts, graphics in alternate languages, working with our CBOs to advertise in radio or on Univision and other areas that we don't necessarily traditionally advertise. And it's going to take more than just Marion County to communicate the safety and effectiveness and the reasons why people should get a vaccine. It's really understandable that people would be a little hesitant to immediately accept getting this vaccine. It was developed very quickly. And I think our approach really needs to be compassion-based because there are a lot of concerns. This COVID really felt like it came out of nowhere. The vaccine was here in a matter of months, which is the fastest a vaccine has been developed. And the mRNA technology that the Pfizer and Moderna vaccines use is those are the first vaccines on the US market that use the mRNA technology, even though it is used in other therapies and some cancer treatment. So it's really understandable why people would question and want to do their research. And so our approach is really around compassion and understanding that people have some fears around the vaccine itself. We're really happy to see people posting on social media that they got their shots and sharing what their symptoms are afterwards, if they have any. My arm's pretty sore today, but that's to be expected, no more than with the flu shot. So I feel very fortunate to have received the vaccine yesterday, and I'm going to be sharing what my experience is like and hopefully help others feel more comfortable as well. We have a Marion County Health and Human Services liaison team that hosts weekly calls for our community partners. Those are open to just about anyone with the exception of press and the general public to ask questions on the progress that Marion County is making. Those are some of my favorite things that I've been doing since the beginning of the pandemic, because it really helps inform the county on what we should be focusing on, might highlight some of my blind spots and others in our planning process. We've been open to feedback. I hope our partners have felt that too. And it's just been a good way to communicate in real time and share what is going on with Marion County's COVID response. There's also a vaccine advisory committee that's established at the state level that will meet for the first time tomorrow, January 7th. And they will be in charge of developing the recommendations and sequencing plan for phases 1B and beyond. We're really looking forward to getting that out soon, because we need to start planning now for how we're going to reach out to the phase 1B, 1C, phases 2 and 3. So now that we've started with the phase 1A, we've got a really good idea of how we're going to approach phase 1B once that guidance becomes available. We have basically made a giant spreadsheet with all the phase 1A, group 1, 2, 3, 4 facilities that we need to reach out to. And we're just trying to work through that as best we can, make sure that people know how to become an enrolled provider with the state and how to go get a vaccine at an open pod or at another vaccinating station. And okay. So our our team is really working hard to track that all in that spreadsheet, and it's kind of the best that we have right now. It's not ideal, but we know how we'll approach the phase 1B in the future. So do get a lot of questions about the COVID vaccine. Is it a live vaccine? Will I have an allergic reaction? Will it change my DNA? One I hear a lot is, will I be mandated to take the vaccine, and how much will it hurt? So the vaccines that are currently available do not contain a live, attenuated, or inactive virus. It's for the gene for the virus protein only. And it means that you cannot get COVID-19 from the vaccine itself. And then currently the CDC recommends anyone with an allergy to any component of the Pfizer vaccine to not get it. Those with a history of allergies, however, should consult with their doctor first, and a history of severe allergic reactions such as anaphylaxis to any vaccine or any injectable therapy is a precaution, but not a contraindication to vaccine. So basically, talk with your doctor if you're concerned about allergic reactions. This vaccine will not change a person's DNA. It does not enter the nucleus of the cell, and it does not affect or interact with the person's DNA. And then mandating to take vaccine. The vaccine is voluntary. Some employers could potentially require this down the road. We don't, Marion County, for example, will not mandate the vaccine for our employers or anybody else. It's also, these vaccines are under emergency use authorization. So those could be a little bit trickier to mandate. And then how much will the shot hurt? Can it cause you to get very sick? So most people do not have a serious problem after being vaccinated. We'll understand more about some of the mild side effects of the vaccine before as it rolls out. The arm may be sore, red, or warm to the touch. And the symptoms usually go away on their own within a week. Some people report getting a headache or fever. And the side effects are a sign that your immune system is doing what it's supposed to be doing and working up, building those antibodies. So next slide. Thank you. This is our vaccine website. If you go to the main Marion County page, the www.co.marion.or.us, you will be able to get to our, oh, there's a bunch of questions in the chat box. You'll be able to get to our vaccine page. We also have a data dashboard. We try to put as much information up there as we possibly can, but we're always willing to answer questions. We have a fabulous team here. We do get a lot of questions from the public and try to answer them as much as we possibly can. So I will stop there. Cindy, do you want to read some of the questions in the chat box, or just want me to go through them?
If you just want to take them from the top, that'd be great.
Okay.
I think it starts with Renee Campbell's.
Okay, thank you. Will there be any way volunteers can help in any non-medical processes when it goes to the general public? I would say yes at this point. If you're interested, we do have a volunteer application on our website. And sometimes we take the people who want to volunteer with us and share it with community partners who we know are looking for volunteers. So if you're okay with that, go ahead and fill out the volunteer application on our website. How are they prepared to handle general public citizens who hear about the fairground setup and just show up and who are not part of the phases for vaccinations in this initial go round? So that's really a question for Salem Health. I cannot answer that one. there is something in the press release about attesting to phase 1A groups 1 through 4, but I don't know what the plan is there. And Deb, the question about speaking to why residents of memory care facilities have not been receiving vaccines at the same time as others in long-term care. We're still trying to get information on the federal pharmacy program and who's been receiving and who hasn't. This is a real blind spot for us, and not something that we're comfortable with. We've been talking with Oregon Health Authority almost daily. And there was some additional guidance last night that came out stating that facilities that are not signed up through this federal pharmacy program were able to go to offer them vaccine. When Meal on Wheel volunteers will be eligible for the vaccine? I'm going to take this question back to our team and see about communicating with the Meals on Wheels volunteers. I think that's a real needed service in our community. And I do have a couple questions I need to ask Oregon Health Authority as well for where do people fall in these various phases. So I will take that question back.
So there's a question just about popping the website up, or maybe you could send that to Cindy later and we can share it. And then next question, we'll save Farah for after Katrina has to hop off. But Dewey had a question about the reason it is likely not able to be mandated.
Yeah, I think there's the part about the emergency use authorization is one reason, and then it could happen down the road. I haven't seen it yet, that the vaccine will not likely to be mandated. I think there's still a lot of people who aren't necessarily ready and willing to take the vaccine. I think that we're in such a state of, it's really difficult for folks to be in the office, come to work, mandating vaccine when a lot of people might not feel comfortable taking it, could have some other unintended consequences. And I think the question about the person with a compromised immune system, I believe the Vaccine Advisory Committee that's meeting tomorrow is going to be determining where folks with compromised immune systems fall within the tiered system for vaccine sequencing. I do not believe it's phase 1A at this time.
There was another question about when a group 55 plus group would be scheduled.
Yeah, probably after we know that all of phase 1A has been completed and we get some additional guidance from the Vaccine Advisory Committee. Okay. Another location to distribute vaccine but be of any use. Potentially, I can put my email in the chat box too, if anyone wants to follow up afterwards. Potentially another location to distribute vaccine. Oh, wow. Hand sanitizer. I would need to check to see. I know we had a lot of hand sanitizer. So I'll have to check on that. But thank you so much. That's really nice.
Great. And we're just about at your time, Katrina. So we'll wrap up, and we want to thank you for making time for us for this important conversation and information. And in honor of you, we'll make a donation to our Salem Rotary Foundation. So thank you so much for the great information, giving us access to some additional resources so we can continue to track and educate ourselves. So.
Well, thank you for having me. It's my pleasure.
Thanks for what you do. Okay, take care. And thank you, Cindy, for bringing Katrina to us as our program today.
Can I provide a little update on the clinic?
Yes, please.
So starting today at the fairgrounds, Marion County and Salem Health are collaborating, and Northwest Human Services is also involved to do mass vaccinating for that Tier 1A group. We've set it up within the last day and have reached out to all of the partners that Katrina mentioned and more. And so that is kicking off as we speak. So we'll keep you informed in that through the e-blasts each week. I can provide a little bit of an update in that scenario for you. Just to speak from the Salem Health side, we have vaccinated just over 3,500 at last I saw staff members within our hospital system, which would be Marion and Polk counties, and are moving forward as fast as we can in this inside. And so now this is our first push to bring the resource to the region and be more involved in that. And like I said, that is kicking off like right now. So I'm thankful that Katrina could still join us. I know that she is on the, we're opening it up right now, which is, she's on that group. So she has to hustle over there to do that.
Great. Thank you, Cindy. And Cindy, I really appreciate you providing those updates every other week that we can share through the e-blast. That's really important. So thank you for that. And then Farah, you had a couple comments you wanted to make before we wrapped up the topic.
And I know one thing on the just side effects. I have colleagues that have had the Pfizer vaccine and the Moderna vaccine. I myself have had the Moderna vaccine. My shoulder was sore for one day. The next day I felt like I ran a marathon. I couldn't even tell you that there wasn't a muscle that wasn't sore, but it wasn't intolerable. And then the next day, everything was fine. It was absolutely nothing. For those that I have talked to with the Pfizer, had the similar effect, very sore arm, a little bit more than the flu shot, and but really no adverse side effects that I have heard of other than that simple flu vaccine, a headache, maybe a slight fever, that type of thing.
Great.
Sorry, Farah, I'll head it to you.
I just had 3 quick points just for folks that haven't heard me say this before. This vaccine does not prevent you from acquiring COVID. It just prevents you from having more serious symptoms from the infection, hopefully prevents you from becoming a hospital patient or an ICU patient, but you still can get COVID, and you still could be spreading COVID even if you've been vaccinated. So that's really important, why we still need the social distancing and masking. Number 2, when you get the vaccine, you have the opportunity to sign up to receive a questionnaire via text from the CDC every day for about a week, and they send you a quick little survey that just asks you, how are you feeling? What symptoms are you having? Have you been able to work or do what you need to do? And then after the first week, then they just start sending you a question like once a week. And so they'll be following that up for a year. So you'll be able to give them new information. And if you post something that's concerning, the CDC will call you and say, okay, what's really going on? And the third thing, why isn't this vaccine mandated? Currently, as a pediatrician, I think everyone should be mandated to get every shot. That's just my bias. But our current country and state does not have the appetite to mandate vaccines, even for childhood illnesses. So people always are able to opt out. So that's where we stand.
All right, great. Thank you so much, Farah. Okay. Let's move on to our business meeting, and we'll start with welcoming guests. Deb Patterson, I'm going to start with you to introduce your guest, who we'll be talking to in a little bit later in the program.
Right, I'd like to introduce President Sue. I'd like to introduce Jason Greenwood, who is a distiller and owner at Divine Distillers, and I'm just really pleased that he's going to be inducted as a new member today. So welcome to Jason.
Welcome, Jason. It's good to have you here today. And then Jane, you had several guests.
I do. I have 5 guests. I'll start with Dewey Witten. She's the principal broker with Salem Real Estate Group. And I'm not sure if you can flash onto her picture, Jessica, but she's here. There's Dewey.
Hi, Dewey.
And then speaking of real estate, Mark Shipman is another guest. Mark is a shareholder with Sawfeld Griggs, which is a law firm in town. And he heads up the real estate and land use issues practice group. So welcome, Mark Shipman. And I know that you're here.
Saw him earlier.
He's here somewhere. Yeah. Then Tom Hoffert is the Chief Executive Officer of the Salem Area Chamber of Commerce. And Tom is here too. So please join me in welcoming Tom. Hey, Tom.
Tom.
Thanks for taking all my emails, Tom. And I believe Mark Mills is here, but I'm not sure. He is a retired marketing director in the semiconductor industry, and that is not a train. He and his wife, Jennifer, within the past few years have moved to the Salem community from Austin, Texas. So please join me in welcoming Mark Mills, if he is there.
There you go.
And last but not least is my guest, Jim Griggs, to whom I'm lucky enough to be married. And those are my guests, President Sue.
Thanks so much, Jane, and welcome everybody. And then I didn't see anything for any other guests coming in, so want to recognize as a visiting Rotarian, Mary Louise Van Natta. It's always good to have you here, Mary Louise. Did anybody have a club announcement? I didn't receive anything ahead of time. Hi, Mary Louise. I didn't receive any club announcements, but want to give folks a quick chance if they do have one. Alrighty. Bell ringers, let's go to you, Ozzy.
I'm about ringing the bell 5 times today because nobody has rung it.
Oh. So are there any bell ringers from the floor that we see?
I haven't seen any yet in the chat.
Alrighty, going once, going twice. Thank you, Ozzy, for your bell ringers. Appreciate that very much. Alrighty, so we are off to our first new member induction in this Rotary year. So really excited about this. So Deb, I'm going to hand it off to you to share the bio that Jason provided us so we can get to know him a little bit better.
Well, honestly, I wish we were meeting in person because it would be just really delightful to be able to sit at tables together. And I know you'll all enjoy getting to know Jason Greenwood when we can meet back together again. He was born in Rio de Janeiro in Brazil, and he grew up in Mexico and in Miami. And so he spent his growing up years in Latin America. He's lived on 4 continents and he speaks 5 languages. He went to college here in the US. He studied in Pennsylvania at Swarthmore, and he met his wife, Janelle, there, and he graduated in 1994. And did Janelle graduate the same year as you? After college, they lived in 17 different US states and in Canada, and England, Belgium, and France. He attended, after college, he had a 26-year career in IT. And I need to back up a little bit. He went to Bayland Jesuit High School in Miami, where he was an active member in the Key Club. And so his service to the community began as a young person at that time. But his work career-wise, he spent 26 years in IT doing enterprise resource planning, work with SAP software. And he ran started and ran 3 different successful consulting firms over those 26 years, working with a number of Fortune 100 companies. Janelle and Jason traveled all around the world during those years. They lived and worked all over the world and were also volunteers in many of the places that they lived. 2010 brought them here to Oregon with their 2 children, Dante, who's now 17, and Angie, who's 13. Janelle's new job at that time was with the Oregon Department of Education, where she has now moved into a new director of the Career and Technical Education program for the entire state of Oregon. Jason continued working in IT and he traveled a great deal, working on projects around the country. But then 3 years ago, Jason and Janelle started the first and only distillery in Salem, Divine Distillers, and opened their doors to the public just 28 months ago. During those first few months, they won 24 international awards, including being named USA Rum Distiller of the Year, Oregon's Brandy Distiller of the Year, and 2 gold medals at the World Spirits Competition, as well as being named the smoothest spirit at the World Tequila and Mezcal Challenge. And so Jason has been extremely involved with the community, and then COVID hit. I think I told you before, when Jason first visited us, that they transformed some of their alcohol into over 100,000 gallons of hand sanitizer, which worked out to be over $300,000 worth of sanitizer, which was more than 3 times their gross revenue for 2020. So Jason and Janelle are people who believe in serving their community and giving back. So, once we get through this pandemic, they're going to grow their business. They've got fine products that build on the agricultural products of our area. They're growing the distillery and the brewery district and help partnering with restaurants. They have an international family, as I mentioned. Their children grew up around the country. And so I hope you will join me in welcoming a very fine member of our community, an incredible community volunteer who brings like Rotary is international, Jason and Janelle are international. So Jason, I hope you will join me in welcoming Jason to our club.
Wonderful. Thank you, Deb.
Thank you, Deb.
Thank you, Deb, for introducing Jason Greenwood into our membership in our club. Recognizing folks that will continue to build this great club and bringing them on board is very important to our livelihood. To show our appreciation, Deb, the club will award you with 250 Paul Harris points towards your next fellowship. So Jason, through your membership in Rotary, you can build lifelong friendships and join forces with like-minded people around the world who desire to make a difference in their communities. And you are already doing that here in the Salem area. Our club is made up of leaders and potential leaders who are inspired by our motto, service above self. As Rotarians, we have all pledged to uphold the highest ethical standards, subscribe to the object of Rotary, and live by the 4-way test. Regular attendance at our weekly meetings is an important part of our membership, but but Rotary is much more than just a lunch club. As you become more involved in our club, you'll begin to understand the power of Rotary through our expanded friendships and involvement in your choice of many of the committees that we offer. As you build those friendships and contribute to our impact here and around the world, you will truly understand what it means to be a member of this club and one of over 1.2 million Rotarians worldwide. We are a vibrant, action-oriented club, and as such, we expect you to roll up your sleeves and get involved. Therefore, Jason, as the newest member of our club, do you pledge to uphold the 4-way test, to serve on at least 2 committees, and contribute to the club in every way that you can?
I do.
Great. And fellow Rotarians, do you pledge to warmly welcome Jason into our club and to offer him your full support in all that we do?
We do.
Here we go. So please welcome Jason Greenwood as our world's newest Rotarian.
Welcome.
Thank you, guys.
Yeah, thank you, Jason. Do you want to, we have just like 2 minutes of extra time. Do you want to say a couple things? Because you've been joining us as a guest for quite a while.
Wow, I hadn't planned to.
I know, COVID got us, didn't it?
So just the fact that I can help people has always been important to me. I know a lot of the people in this group already. You know, they know me, they've seen what I've done and what I like to do, and just being able to help out the community and help out people has always been important to us. I've wanted to join Rotary for 20 years, but with all our travels, with us living all over the world, that has never been a thing we could do. When we first moved to Oregon, I was here 3 days a week at most. So the idea of spending even an hour on a call instead of being with my family was not something that I was willing to do. Now that we've started a business here in Oregon, the first 3 years we've been a little crazy. So I've never seen any kind of growth the way that we've done it. And I've been working 24 hours a day, 7 days a week for the better part of those 3 years. So the idea of joining Rotary was not possible until just a couple of months ago. And now I'm glad that I can finally be part of it. Thank you.
We're excited to have you. And many of us know that you, including myself and my organization, we know that you've been very involved in our community and working to support a broad range of individuals and organizations. So looking forward to working with you and getting to know you much, much better. So again, yeah, absolutely. Welcome. So just checking the clock. We're going to give you the gift of time today. Our program next week will be the first in a series on restoring the canyon after the fire. And next week will be Kyle McGann with Marion County Fire Department, and Warren Bednarz will be our program chair. And then in closing, I want to again congratulate Jason as our newest club member. Please, everybody, make an effort to reach out to Jason. He and I caught up on the phone a few weeks ago, and it was just an absolute pleasure to chat with him. And then I want to thank our guests that joined us today, Dewey Witten, Mark Shipman, Tom Hoffert, Jim, of course, and then maybe Mark Mills if he made it. So wish the best to everybody on the call today. Hope you saw the article about the amphitheater in the paper a couple days ago that Cappy Lynn wrote, and just wish you all the very best. And we'll see you next week. Take care, everybody. Bye-bye.